So I am going to welcome everyone to getting off to a good start. The importance of early childhood to lifelong health, provided by the PA Care Partnership Grant in association with the Office of Mental Health and Substance Abuse Services, also known as OMSAS. The preschool years are an amazing time in a child's life, a time filled with growth, joy, and sometimes challenges. This presentation will focus on the importance of early childhood and the lifelong impact of getting off to a good start. We will discuss the value of early relationships, the impact of chronic stress on children and families, when to think about consulting a behavioral health provider, and what interventions are available for young children, what caregivers should consider when looking for treatment. This session will be interactive with lots of opportunities for questions and discussion. During the presentation, please type your questions into the Q&A feature, which you will find by running your mouse along the bottom of the Zoom screen. Today's moderators are part of the PA Care Partnership. We have myself, I will be monitoring Q&A, and we have Nancy, who will be monitoring the chat. And I will switch it over to Nancy to introduce our presenter.
Hi, everyone. I'm excited today to introduce you all to our speaker, Dr. Amy D. Herschell. She is the Senior Director of Research Strategy and Outcomes Management for Community Care Behavioral Health Organization, UPMC Insurance Services Division, where she leads the development and implementation of rigorous, high priority evaluations and oversees outcome activities in support of a program advancements such as early childhood wellness, evidence-based practice implementation. She's trained and licensed in Pennsylvania as a clinical psychologist. Dr. Herschell's clinical interests have focused on collaboratively developing high-quality, community-based care for our young people. Now, I just want to let you all know that we definitely are asking you to put your questions in the Q&A at the bottom. And we will go through and hopefully get to everyone during our Q&A after the presentation. But Dr. Herschell has told us that she may be jumping into the chat from time to time with a quick question. So keep your eye out for that. And with that, I say, welcome, Dr. Herschell.
Well, thank you so much for that very kind introduction. And both Nancy and Jamal for your support with this webinar. I'm very grateful for all of that. And I'm also very grateful that all of you have taken time out of your, what I'm sure are very busy days to attend this webinar this afternoon. So thank you so much for being here. And we're going to do our best to make sure that your time is well spent and invested. So Jamal, if you don't mind going to the next slide, that would be great. Of course, I want to welcome everybody and just wanted to give you a little bit of information on kind of what to expect and what I would request or hope. One thing is that we have a large group today, and I'm very grateful for that. We're going to do our best, even with a large group and even with a webinar, to make this as interactive as we can and as relevant as we can. So those questions that you type in would be great. We're going to make sure that we have plenty of time at the end to address questions, but also as we go through, I'll try to make sure that as you're asking questions or putting information in the chat, that we're checking in, because I certainly want to make sure that we use your time wisely and that the information presented is relevant to you. And what I would hope is that you give us your full attention, which I know is really hard in this multitasking kind of world that we find ourselves in. And also that you put your information, whatever you're thinking about, in the chat so that we can have as much of a conversation today as possible with this kind of platform. So Jamal, if you go to the next slide, what I thought we would talk about today is a little bit about how early childhood affects health and learning over the course of a person's life. I thought we'd also talk about the impact of COVID on children, and I thought we would chat about that about that impact in nationally. So what we're learning from studies that have been conducted across the US, but also what we've been learning about studies that have been occurring in Pennsylvania, so that it's even more relevant to our local communities. And then I thought we would chat about some mental health treatment options for young. And when I say young, I really mean preschool children. And what I thought is that I would give you an example of a really high quality, rigorous intervention called parent-child interaction therapy. And we would talk through that intervention so that you know a little bit more about it, but also so that it serves as an example of what you might want to look for in treatment approaches for young children. So if you go to the next slide. One of my favorite things about thinking about early childhood and talking about early childhood is that you get to think and talk about young children. And I don't know about you, but they are one of my favorite. My kids are older now, so I feel like I can't quite say this anymore, but preschool is my favorite age because there is so much happening in the preschool years. And when I say preschool, I'm really thinking ages 2.5 up to 7 years old. So when you think about 2.5, and this is our first chance to talk about the using the chat function. So with the chat function, if you wouldn't mind, please let me know the answer to this. Type the answer to this question in the chat. And the question is, what are some of your favorite things about preschool children? Ready for school, to succeed, no filter. Isn't that the truth? Imagination, honesty, inquisitive nature, that they're just awesome, innocence. I agree. Language, socializing. The funny stuff they say, how curious they are, that they're coming into themselves. Emotional, yep, we'll talk about that. Sponges and daredevils. Adventurous. Fearless. Sassy. And have an excuse. Yeah, I'm like myself. I like that. I'm with you, Christy. Okay. Yes, definitely sassy. I agree. They're open-minded, affectionate. All of these things, yes, are why preschoolers, it really is such an amazing time. And you all are right that it is a time when children are coming into themselves, that they're learning a lot about themselves and their environment. I noticed one of the comments also that somebody said they're like sponges. And I completely agree that this is a time in life where so much development happens, where kids are sponges in their environment. So their environment really starts to shape them in a lot of important and meaningful ways. One of which, I like that, so stubborn. They can be very stubborn. Let's talk about that too. When I'm jotting notes down, it's to remind myself to come back to all these good points. So yes, children at this age are sponges and they're learning a lot from their environment. And Jamal, if you could do the points down, keep going. All right, stop there. Oh, okay, that's good, perfect. It's all good. Yes, so they are sponges in their environment and they're learning about all of these important things. So from their environment, they're learning about social emotional development. So they're learning, one of the comments was that children are emotional. Yes, preschool children are not yet known for their emotion regulation, right? This is a time where they're figuring that out. They're sorting out all kinds of things, and they're doing that in the context of their environment, and more specifically in the context of their relationships. So they're learning about how people behave towards one another, they're learning lots about language and about communication. And so this is the time when we really see lots of amazing language development and expression and cognition, where kids are starting to really put the pieces together and figure out their world. So I love the preschool years because kids are really fun at this age. They're entertaining for sure. They're adventurous. They're fearless and sassy. And they're also figuring out, somebody had said stubborn. Yes, they're also figuring out their boundaries. You know, they're kind of coming into themselves and learning how to be their own little people in the world. So they're learning and they're testing a lot of limits because they're figuring out those limits and boundaries within relationships. And so all of that, I think, is very important as we think about, we think about what typical development might look like, and then what development that's a little bit atypical might look like, where we might think about what's happening and what's happening with the child's behavior and what's happening in that child's world. Before we go much further, though, I think it also would be really helpful for me to understand a little bit more about the backgrounds that you're coming to the webinar with. So I wonder, Nancy, if you'd be willing to do that poll to just have people first talk or indicate a little bit about their role. Is that okay, Nancy?
I just put it up. Are you not seeing it?
I'm not seeing it, but maybe others are.
Jamal, are you seeing it? Anybody? Nobody's seeing it. Well, shoot. Oh, here. Now you should see it. No.
Yeah, it says, what system do you work in?
Oh, okay.
So folks can just pick one of those, the one that's closest. I know they might not be completely comprehensive, but the closest one would be great.
We've got a pretty good, yeah. Shall I end it now, Amy?
Mm-hmm. Yep, that'd be great. Look at that. So that's really interesting. So we have a good representation of family members, behavioral health, child welfare, education, some from juvenile justice, physical health, and SUD. That's great. Very good. Thank you. That's helpful as we go forward. All right. So we were talking about what we know about early childhood and what we know about all the wonderful, magical things about preschoolers. One of the things that I think is also important is to think also about what happens when children are under a lot of stress. So one of the things that I wanted to share with you today is this video that Jamal is going to bring up for us. And the reason that I thought I'd show you this is because it talks about, it's brief, it talks about the impact of toxic stress on lifelong health and learning. And it also says it very succinctly, which is a good thing. The other thing is, and I saw somebody had put a comment in about resources. One resource that I think is really helpful is the Center on the Developing Child at Harvard University. And so this video is from that source. And you'll see, if you happen to go to their website, I think Nancy will make sure that people have the slides afterwards. And if you go to that site, you'll see that they have a lot of really helpful information. They keep it current, and you can even sign up for a newsletter that they send out. I think it's, you can, I think it's about every other week. It's not quite weekly and it's not quite monthly, to be honest, but it's a very, very helpful, rich source of information and a trusted source of information. But with that, I'll ask Jamal to show the video and then we'll chat a little bit about it.
The early childhood brain development story has been a powerful influence on the growth of investments in programs to promote early learning and enhance school readiness. But the brain does not exist by itself. Connecting the brain to the rest of the body is critically important. Early childhood experiences are as much about lifelong physical and mental health as they are about early learning and readiness to succeed in school. All biological systems, all of them are highly interconnected, and all of these systems are primed to adapt to whatever the environment would throw at us. Think about this as a team of highly skilled athletes. Each has a role to play, but they depend upon each other. They influence each other's responses. Like any good team, it's how they operate together that is the key to their success. When we are stressed, every cell in the body is working overtime. The brain is the master control system that detects threat and then manages the response of all of the different systems. It sends signals to the cardiovascular system to increase heart rate and blood pressure. Signals are picked up by metabolic systems to increase the availability of blood sugar to provide more energy stores for the body. The immune system is activated to be on alert for the possibility of a wound or the need to protect against infection. The neuroendocrine system is activated to increase levels of stress hormones in the bloodstream. All of these also provide feedback to the brain. The stress response system was designed to deal with an acute threat or challenge. But when the stress continues at a very high level, then these biological responses actually start to have a wear and tear effect on the body. This is where stress explains chronic disease. The science is really clear. The most costly chronic diseases in our society have their roots in early childhood. Cardiovascular disease, diabetes, and depression, 3 of many diseases that are associated with greater adversity early in life. Those 3 diseases together consume more than $600 billion of healthcare costs a year. So if we want to think about preventing disease and promoting health, it doesn't begin with exercising more and eating better when you're 30 or 40 years old. Health promotion and preventing disease begins prenatally, and it extends into the early childhood period. Connecting the brain to the rest of the body has very important implications for early childhood policy. If we look at the basic science-based principles focused on early learning, strengthening relationships, building skills, reducing sources of stress, those are the same principles that increase the likelihood for lifelong physical and mental health. And when we think about the major sources of adversity early in life, we talk about poverty, discrimination, exposure to violence, maltreatment, child abuse, and neglect. Although each of these sources of adversity differ from each other, biologically, the effect on the body is the same. Systemic racism, the dangers of implicit bias, and everyday discrimination impose a level of stress and adversity on families of color raising children that is present all the time. It's never too late to make things better, and we are biologically prepared to adapt to whatever environment we live in. But we need to look upstream at more systemic issues that are the sources of this enormous burden of threat and hardship. We have to connect policies and resource allocations from the educational sector and the health sector and the human services sector. Pediatric primary care is the one domain where almost all children are seen from birth on and provides a critical opportunity for engagement with families and developing relationships, promoting healthy development, and is the ideal frontline opportunity to connect families to needed services as early as possible when they can be most effective. Pediatrics alone is not going to provide all of the supports that many families need. The opportunity is to move away from asking, how do we connect pediatric primary care to early childhood programs? And in a different way, change our mindset to say, how do we build a new early childhood ecosystem in which pediatrics is an integrated part. The brain development story has been a powerful influence. The same principles, the same concepts are also affecting the early foundations of physical and mental health that will last for a lifetime.
So I'm going to encourage you to type in the chat what you found most interesting about that video. I'll say what I think is really important and meaningful, and that I hope that you take away from it, is that the experiences that children have early on really are impactful over time, and that there is importance in thinking about whole person health and valuing the integration between physical health and behavioral health. And the earlier we can do intervention, the better. And the intervention we should think about things within our interventions like reducing stress, increasing skills, and one thing that we're going to talk a lot about today, which is strengthening the relationship between caregivers and their children, because that can serve as an amazing protective factor for children. And I'm looking in the comments, and it looks like many of you resonated with the video in the same way. Serious of the connection between your bodily health and stress response, that responsive relationships matter absolutely to behavioral and physical health, and that stress can affect you long term, as well as toxic chronic stress. And one thing that I also wanted to talk about to kind of put more of this into context is the impact that COVID has had on children. Because if you think about stress, we really all have been experiencing a whole lot of stress lately. And that has been, that's been borne out in the data as well. So if we look at national studies, we see that even early in the pandemic, these studies that I have on this slide are from 2020, so very early in. We could see that even then, people were talking about, or studies were demonstrating that 27% of parents were reporting that their mental health symptoms were worse for themselves, and 14% were worse. Parents were reporting 14% reported that their children had worsening mental health symptoms. And the reason that I chose this study in particular, because the trend is similar across them, is that this study talked about caregivers and their children. Because I feel like when we have conversations around preschool children, we need to always be thinking about the importance of the caregiver and the stress that's also on the caregiver. And also, we know that the impact of COVID has really even impacted things like this study from the CDC that showed that mental health related emergency department visits had increased 24% among children and 31% among adolescents early on. If you go to the next slide, Jamal, you'll see that when you think, and by the way, I'll just say that in each of these slides, which Nancy mentioned you'll be receiving later, I really tried to be careful about which resources I included, and you'll see that there are links to the articles that are cited or the videos that are included, so that later, if this is something of interest, you can go back and click on the links and get the studies and all of that. But what this study showed is a little bit later in the pandemic in 2021, this person, Dr. Mead, did a study to kind of summarize a lot of the work that had been done. And it really showed that the impact of COVID is because of what we would expect. All of the things that serve, not all, but many of the things that serve as protective factors, like pro-social activities, going to school, having access to mental health care and medical care, decreased during the pandemic. Whereas the things that cause stress and strain increased during the pandemic. So social isolation, health and safety concerns, caregiver stress, and family conflict. One of the things that is often reported about the pandemic is that there has been increases in parent-child conflict, increases in intimate partner violence, and many reports of child maltreatment. And at the same time, we have lots of children who have had increased screen time and more sedentary behavior. I see somebody just said they have a high increase in referrals and believe it to be related to COVID. Yes. And you can see that there has been, and I know for many of you who also have children, the adjustment and readjustment to online learning processes has been really challenging during the pandemic. And when you think about it, for school-age children, it's one concern. I think preschoolers, it's even tougher, because if you think about the things that we talked about, that we love about preschoolers, that being curious and wanting to learn and being so wanting to kind of absorb everything they can about every social interaction and academic skills, that was really difficult for preschoolers who were doing online kind of experiences. And I say for those who were doing online, because I think many people said, you know, we can't do that with a preschooler. We're just going to wait it out, and they'll go to school, you know, maybe they'll go to daycare or a preschool setting a little bit later. We'll hold off on that because of our concerns about health for a year, or, you know, then it's a second year. So I think a lot of kids haven't had the same type of early learning experiences that you would typically have. And those who did even had this disruption because of going back and forth. And really having to do online is, I will attest to, I have now a 10-year-old and a 15-year-old. That's hard enough. I can only imagine how hard it was for our caregivers who had preschool children trying to do online, or even kindergarten, trying to do online schooling with them. So I say this all because I think we're really coming out of a tough time. I'm optimistic that we're coming out of a tough time. But to acknowledge that it has had a substantial impact. If you go to the next slide, Jamal, what I just showed you on those slides really were national studies. But I think we're seeing those same things borne out in our local communities as well. What you have on your screen here is the PAYS study, the Pennsylvania Youth Study, which is conducted by a group at Penn State, and they survey Pennsylvania students in 6th, 8th, 10th, and 12th grade. And I know we're supposed to be talking about preschoolers, so not necessarily the older children, but I will say that I think it's really important to have this information. This is just out over the last month. The information was released, and that if you go to the link later, the state reports, you'll see that you're able to look at this information. The PAYS has a lot of information about different domains. I pulled out for you just the points that were most relevant to our conversation today, that we know across our Commonwealth that for children in these grades, that protective factors decreased over time, and that mental health concerns and suicide risk behaviors have increased during the pandemic and over time. If you go to the link that's provided, you'll see that you can actually access this information and a lot more from the PAYS data. You can access it at the state level or at your local county level. And I think that's really helpful for many of you who are in roles where you're doing planning, you know, thinking about what might be offered to children in your communities over the next year or two or more. I think this data can be helpful to plan for that. But if you go to the next slide, the one thing that I really want to emphasize is that while all of those are concerns, I think concerns to me, and certainly probably many of you, if not all of you on this webinar today, I think the good news is that what matters most is what you see here. The single most common factor for children who develop resilience, who can keep on going through these tough times, is at least one stable and committed relationship with a supportive parent, caregiver, or other adult. And I intentionally put on this slide a picture of a preschooler and a grandparent, what looks like might be a grandparent, because while we hope that that stable adult in the child's life is their parent, it also could be a caregiver or any other adult in their life. The most important thing is that the child has somebody who is essentially like their safe base that helps them to weather these really difficult storms and difficult times. And that we do our best to help make sure that that person in the child's life has everything they need to be successful themselves and for them to help the child to be successful. So if you go to the next slide, this is where I was hoping, Nancy, we could do our next little poll to see. I am curious how many of you have heard of an intervention called parent-child interaction therapy. So if you've ever heard of it, hit yes. And if you've never heard of it, hit no. And either answer is okay. I'm really just curious.
It's starting to slow down, so I'm going to end the poll.
That's amazing. So 57, that's really good. 57% of you have heard of PCIT. 43% say no. So really good to hear that you have heard about it. And people are mentioning issues around access. So we'll talk about that a little bit later too, access to PCIT and also other services. If you go to the next slide, Jamal. So many of you probably already know that PCIT is an evidence-based intervention for the exact age range that we're talking, children ages 2.5 up to 7, but particularly children who are experiencing some disruptive behavior. Excuse me. Now, disruptive behavior in preschoolers can mean a whole lot of things, because that's how children express themselves, really, is through behavior. So it might mean that they're having some difficulty with those limits. Remember how we talked about how they're learning their relationships, and somebody had mentioned that children at this age are pretty stubborn. Some kids are really stubborn who continue to push back about rules and norms. Once you say no, they say, oh, I'm doing it. And you say no again, and they say, oh no, I'm really doing it. That might be one thing. It might also be that behavior means that, kids are having a hard time with routines, or they might be stressed and have some anxiety. It might look like disruptive behavior, but it might really be anxiety or irritable mood is associated with depression. So disruptive behavior, my point though, is that disruptive behavior can mean a lot of things. So it's important to not necessarily assume one thing or another with it. But for children who really are experiencing the kind of disruptive behavior that we talked about first, that's about oppositionality, that is the kind of behavior that this intervention in particular was designed for. Many of you know that within PCIT, you work with the caregiver, whomever that might be, and the child together using this coaching platform. And what I thought I'd do is, if you go to the next slide, Jamal, is show you a little video, because to see it, to talk about PCIT is one thing, but if you've never seen it in action or heard about it before, it's much easier to see it in action. So that's what this video will show. But before we do that, I just wanted to mention that part of the reason I also wanted to talk about PCIT is that I feel like it is a great example of an intervention for young children, that if you thought about what would be kind of a great approach for families with young children, this is a great one. And we'll talk about how some of the components, maybe it's that not that every child gets PCIT, for example, but there are components of it that I think, and principles behind it that I think are particularly helpful for preschoolers. And we'll talk also about other approaches. But before we do that, I'll be quiet and let Jamal show this video.
We're gonna knock the car down. One car down.
You did it! You knocked it down! Good job!
Nice label praise. You're becoming more and more involved in this play.
These parents and their children are learning how to interact, how to communicate more effectively, and how to transform their relationships and their lives for the better.
You're doing a great job playing gently with the toys.
They are participating in Parent-Child Interaction Therapy, or PCIT, at the University of Miami. The program is for families with children who display behavioral problems that parents are unable to cope with on their own. What makes PCIT unique is that therapists coach parents through an earpiece, teaching de-escalation methods and positive interaction that result in improved behavior. It's called life therapy, and the outcome can be life-changing.
He was having tantrums on the floor and stuff like that. With this program, they put a little earpiece in your ear. She's watching you. You're seeing, okay, we're interacting together, and she gives me tips on, oh, you should do this, or just ignore right now, or right now you should try to distract.
If their kids are getting into trouble at school, or if they're having difficulties listening at home, our job is to help them be able to relate to their kids better and also learn more effective discipline strategies.
Funded by the Children's Trust, the program works with families for free and for as long as it takes. These live therapy sessions through one-way privacy glass are helping Erica Wooden discover new and better ways to relate to her son, Cornell.
Before, it used to be so much frustration between both of us because we couldn't communicate with each other. He used to try to express things to me that I didn't know he wanted. So it's more joy, is me being able to figure out what he wants now. Tantrums have declined, so I don't feel bad at all when I have to take him somewhere, because I know a tantrum is not going to occur because I use these skills with him.
Let's focus on describing his behavior.
Good job building the blocks.
So that's a nice label praise.
When psychologists start working with a family, the child is often described as being out of control, and parents are at their wits' end. Then, in just 3 of 4 sessions, everyone begins to see improvement.
There are moments during the course of therapy where you can see where it happens. So you can see, I remember 5 weeks ago, this would not be happening. You wouldn't be smiling at you wouldn't find this fun.
I like when we work together.
It changed our lives. It helped make Matthew listen better to me, help me understand how to treat his behaviors that I was seeing, and it really helped both of us.
By teaching parents how to relate to their children through play and other techniques and discipline in more positive ways, PCIT is reducing the risk of child abuse and helping to strengthen bonds between children and the parents who love them.
It's not an easy road up front, but that initial investment will pay dividends for that child's lifetime.
The work that we do changes families and changes lives, but it also changes us as we grow and benefit so much from it as well.
For this experience in total, I would definitely give it 10 stars. It's so much of a blessing to have.
All right. So I will say that the reason that I saw a couple of the questions and I took a minute to look at the chat, which I think is really helpful. And I'm really glad we're going to have some time at the end to answer some of the questions. And I see the questions are really around, some of the questions and comments are really around access to behavioral health care in general, and also to PCIT specifically. And so we'll talk about that because that is certainly a challenge right now for sure. Let me give you a little bit. I think this is clear. Some of this comes through the video, but I'm just going to highlight a couple of points related to PCIT that I think are particularly important as you think about this as an intervention, but also other interventions for preschoolers. One is that PCIT has two phases. One is focused on relationship enhancement because, like we talked about earlier, that is such an important point and such an important thing for children, is that they're learning so much in these years in the context of the relationship. So we want to make sure that in any treatment that is offered to this population, that there's work, there's attention paid to the relationship between the primary caregiver and the child. Because this is an intervention where behavior management is an important part, that children are coming to treatment because they have high level behavior problems, that this is also contains, it directly treats that. The goals of treatment include promoting a warm, nurturing caregiver relationship where there's balance between nurturing and consistent limit setting, because we know from the developmental psychology literature that that's the optimal parenting approach, one that balances nurturing with consistent limit setting. Also, the goals of this treatment, like other ideal treatments for preschoolers, are ones where they increase the child's pro-social behavior while working to decrease some of the challenges. But remember in the video how they talked about kind of three key pieces are strengthening the relationship, increasing skills, and reducing stress. This is an area where we are in PCIT, we're working to increase parent skill, but also child skills and behaviors, because it is the context of that relationship where children are learning all kinds of important things about how to interact with others and how to interact in the world. So they're learning things like how to listen, how to actually do what an adult tells them to do, which is sometimes hard, some preschoolers. They're learning how to share, how to take turns, how to receive positive information about themselves and take that in and believe it. So all of those things are what we mean when I say increase pro-social behavior. And the other part is really that this intervention, like others that you want to recommend for this age group, really focus on enduring change, not just this moment, not just managing this one behavior, but thinking about how this caregiver is going to be with the child for the course of their life, and how can we work together with the caregiver to ensure the best outcomes for the child. Okay, if you could go to the next slide, please, Jamal. So we talked a little bit about this. PCIT is for young kids who are demonstrating some disruptive behavior. And one of the questions that I saw came in was, how do you know what's considered typical versus atypical behavior? And this is some of it. You certainly, I think when caregivers have a really good sense, when they're worried about their child's behavior, I think that in and of itself is enough to get an evaluation and understand what's happening. Because what happens when you come in and sit down and chat with a behavioral health provider, if you're looking specifically at PCIT, they're going to do an interview to understand a little bit more about what you're experiencing. And they're also going to give you some questionnaires to complete that help the clinician to understand your child's behavior in relation to typically developing peers. That's always kind of the concern, is this within normal limits? Is this what you would expect for a child this age? Or is it outside of that normal limits? And there are some things that might give you an indication of that, like these, if you're seeing these kind of behaviors frequently, and if they concern you. Things like verbal and physical aggression, defiance, and by that I mean repeated non-compliance. So that means that you tell the child to do something, and 8 out of 10 times, they're going to say, nope, they're not doing it. That they are really pushing back a lot. They're having a lot of temper tantrums or really high levels of activity. And PCIT is certainly appropriate for those, for children with those kind of behaviors, or a few other interventions that we'll talk about as well. And certainly it's appropriate for parents who want to learn more, or if they have a style that they want to make sure is more in line with that nurturing with consistent limit setting that we talked about. If you go to the next slide. These are the important factors within, or the important components of PCIT that really make it kind of what it is. That the parent, and this is what I really think I want to very much emphasize is important in services that you seek for young children, is that the parent and child are seen together. Parents, like we talked about, play such a central role in the child's life that they, my opinion, and the science would suggest, is that the parent and child need to be seen together in treatment. Also a focus on interaction patterns, not one specific behavior like we talked about. And in PCIT, what I think makes it most helpful and results in big treatment changes is that it's coaching. So it's that you're working with caregivers around very specific skills, and then you're actually, as a therapist, as you saw in that video, the parents are given a bug in the ear device. They're in the room with their child, and then they're coached in specific skills. It's also performance-based, so it's not based on a certain number of sessions, but it's instead how people progress through the treatment. And I think what's really important with that point and the assessment-driven is that we also know that treatments are better when you get regular feedback from people. So clinicians should be asking regularly, by regularly meaning every session, to understand what the experience is like for the caregiver, and what the caregiver, how they think the treatment is progressing for them and for their child. And for PCIT, it has a strong empirical support. If you go to the next slide, Jamal. It contains a strong coaching component, which we'll chat about in just a minute. But if you go to the next slide, when I say empirical support, this is the recognition for PCIT as an evidence base. So it has about 50 years of research and over 300 studies that have been published about it. If you go to the next slide. But I want to make sure, let's keep going. So with PCIT, I'll tell you the outcomes are that, parents, we see strong skill acquisition, parents report satisfaction with the treatment process and also the outcomes, and that they report more positive attitudes towards their child, and also that they self-report improvements in mild depression and anxiety. If you go to the next slide, we know that for children, we see really big improvements in improving behavior, improving compliance, and parents report that their child's behavior, like we had talked about, normal limits, outside of which limits, they report that their children's behavior goes from the clinically significant range to within normal limits. And we also know, if you go to the next slide, Jamal, that change lasts for 1 to 6 years. So studies have been done with PCIT up to 6 years post-treatment and have seen that treatment gains maintain. And they also generalize to untreated siblings and to the child's behavior while they're in a preschool setting. So if you go to the next slide. But PCIT I think it's a great intervention for the reasons that we talked about. And those are the kind of components that I think are important to look for in other approaches, but it's not the only approach. So there are other interventions that might be available in your communities, and these are just a few of them that all are kind of have very similar content. So these interventions, and these are just some of the names of them, family interaction training. It's called FIT, the Incredible Years, Triple P, the Defiant Child, Helping the Non-Compliant Child, and Parent Management Training are all very similar to PCIT. What will be different is the content is similar, the format is a little bit different. So PCIT really relies on that coaching, whereas some of these rely on other more traditional methods of that you might think of when you think of behavioral health treatment, like going in and talking to somebody, or like the Incredible Years can be done in a group and relies on video. So you watch a video and talk about you know, how the child's behavior looked in that session, for example. So all of these are great programs. All of them have good research behind them, and they're very similar to PCIT in content. And for the same population, preschoolers with some disruptive behavior. If you go to the next slide, Jamal. I thought it was just important to emphasize that, as I think we have, that what should the primary caregiver really expect from treatment when you're seeking treatment for a child in this age range? And the most important thing really is to be actively included and to also have your questions answered about treatment. And that includes things like the length of treatment and the effectiveness of the approach. So I would encourage folks to ask ask clinicians what they think the effectiveness of the intervention is that they're being offered. Because we do know that there are approaches with good research behind them to suggest that they would be effective. And I put on here too, and anything else. I really think that in general, as we think about how we are consumers of medical treatment and behavioral health treatment and any kind of early intervention service, it's really important that we all think about what questions we have and make sure that they get answered, because it's really, I think the parent's choice and the parent's voice and the expertise of the parent or primary caregiver really needs to be respected in any intervention, but particularly when we're seeking care for our young kids. If you go to the next slide. One thing that I thought about as I was getting ready for today is that I feel like it's so tricky. It's so tricky to navigate the behavioral health system. And it's so tricky to try to figure out what kind of to recommend to families. And as a family member, what kind of service you want to receive. And so I put this slide together just so that you would have some resources around some of the things we talked about. So first is PCIT. So you have that link if you're curious about it. That takes you to the PCIT International website. The next one, this evidence-based prevention and intervention support, is Penn State's Epicenter. And they have information about some prevention kind of services. Not all of them are early, like our preschoolers age, but I think that might also be a helpful local resource, particularly for many of you who are in roles where you're thinking about building up communities that care or community supports. And the other link that I put in here is a link to effective child therapy, because I felt like, I certainly wanted to talk a little bit about PCIT today, but wanted to also emphasize that it's one of many effective interventions. I'm very grateful that in child therapy, there's a number of research supported interventions. And the link there to effective child therapy will take you to the Society of Clinical Child and Adolescent Psychology that gives a lot of good information about specific interventions and what to ask, how to prepare for sessions, all of that kind of information. And I feel like that's a trusted source because, oh my goodness, if you go on the internet, there's so many. If you type in evidence-based practices or child therapy, so much comes up, but what to trust is the question. And so I think this is a really helpful site. The other one that if you are somebody who likes to know the details, or if you want to look at lists of evidence-based practices, the link here that I included the results first clearinghouse database from the Pew Charitable Trust, excuse me, is one that looks across, because I don't know, many of you probably have looked for lists of evidence-based practices, but even that can be tricky because certain groups will establish lists of evidence-based practices based on what's important to them. So recently we've had the Family First Preservation Service Act, which has, that group has looked at which treatments they consider to be evidence-based practices. What's on that list might be different than what's on the California Clearinghouse, for example. And the reason is because of how they're evaluating the studies and what the outcomes are that are most important to an individual group. So it gets complicated with these different lists, but what I liked about the Pew Charitable Trust is that they are pulling across multiple lists of evidence-based practices. And with that, let's see what questions we have.
Oh, Amy, are we going to hear that last video about with the father and son?
We will if we have time. I want to make sure that everybody's questions are answered first and that we've gotten to the chat. And then as we make sure we have everybody's needs met, then I do have another video that I think you all might be interested in.
All right. So with that, if you have any questions for Amy, if you could put them in the Q&A, and I will gladly ask them. There are a couple of questions in there right now. Shelly had typed into the Q&A in the chat earlier, and I really wanted to make sure that I got to this question. She says, our program is seeing a high increase in referrals, we believe due to COVID. Are you anticipating an increase to a decline in long-term health due to the impact the trauma of the pandemic has caused on young children?
You know, I think, Shelley, this is such a good question for you to ask. It's, I think, on all of our minds, where I have for sure been worried about the impact of the pandemic. And, you know, Nancy in the beginning mentioned my role with community care. And as part of my role with community care, we've done surveys of our provider network. So we work in 42, soon to be 43 counties across the Commonwealth. And we've done surveys to try to understand more and more about the workforce and what's happening and what they're experiencing. And what we have learned from them is that there's certainly, you know, you all had mentioned the question, or put comments in about access. Yes, that we are facing a challenging time in Pennsylvania and across the US, where we have workforce shortages and we have higher behavioral health needs than we've had before. And so it's this you know, tension between those. And I do share what I think might be your concern, that for young children, we're going to see the impact of the pandemic over time. So certainly there's a high need now, but we need to do everything that we can. And one thing I think that we really can do is shore up care, you know, make sure that caregivers have what they need to help support young children, so that there isn't an enduring long-term effect for children. Because if you think about how many of the supports have been pulled away of what they would typically have, that's where I get concerned about long-term impact. And that coupled with our workforce shortages. And when I talk about surveys that we've done at community care, that's just in behavioral health. That hasn't been child welfare that we've known has had some staffing shortages in other areas like education, childcare, early intervention, Head Starts. It's been across the board.
I think it's been hard, and I think Nancy and I talk about this fairly often with how we don't necessarily think about how the pandemic has affected us as people, period, and how that trickles down. You know what I mean? You know, especially the first year when everybody was on lockdown, and you know, it's that isolation, and you're not seeing people as much. Schools went to virtual, and young children didn't have that classroom experience where they got to mingle with their friends and things of that nature. So it brings up all of this anxiety and depression that you start to see in people. So I thought it was a really good question, because I think with now people starting to think about maybe we're out of the worst of it, and so they don't feel like it will have a lasting impact. But I think it's just like you said, it'll take some time before we really truly know what's going to happen with that. So
I agree. And don't you feel, Jamal, like there are times when you're in a stressful situation, you're just doing your best to keep on keeping on, you know, but it's only after you have a pause, a time of less stress, and you have the opportunity to reflect back when you realize how hard it was. And I don't know that we're at the end of that for many people yet.
I totally agree.
I don't mean to be, I'm pretty positive. So I don't mean to be negative. I'm just also trying to be realistic. You know, think about what can we do now to make sure that our preschool children get the kind of supports that they need.
Yeah. Totally agree. Jamie asked, and this goes back to your thought of seeing things in the chat about resources and things. Is there a list of PCIT providers that are seeing families? She knows that COVID had greatly impacted this. Is there a resource that people can go to see who's providing? Is it covered? I know it was an insurance question in a chat at one point. So do you know of a list or anything?
Yes, so I see also that somebody has shared for community care. There's a link in there where if folks are in one of our counties, there's a list of places folks can go. Nancy's going to send out some information afterwards, and it's going to have a link to a site called the Early Intervention EC Innovations, Early Childhood Innovations, and it has a list of Pennsylvania providers. Now I'll say, the list is a little old. It's hard to keep updated because with our staffing, you know, anytime the behavioral health field is fluid, you know, people are coming and going sometimes, and they're learning. So their skills change. So it's hard to keep any one list up to date. But that should give you, those at least should give some good starting points between the community care list and the list that the website that Nancy's going to send out called ecinnovations.org. That has a list of Pennsylvania providers on it. The second part of the question was around insurance coverage, and most, for our members who have Medicaid as their primary behavioral health insurance, PCIT services are covered. And also for many private insurances, it's considered an outpatient therapy. And that's another question I think that might have come up in the chat, is like, you know, which level of care to seek services in. PCIT is an outpatient service, so that's a good level of care to consider, at least as an entry, if you know, into behavioral health care. Just something to consider.
Yeah. Always think it's much better if you can get care in the community if you don't have to be inpatient, or get to a higher level of service.
Yeah, the least restrictive or the least
Yes.
restrictive that's appropriate for the behavior. And these are preschoolers.
Yes. Totally agree. So we don't have any more questions in the Q&A. I do see one in the chat that Ashley has asked. With all that you were just saying, has the state recognized the severity of mental health? I'm not sure if you know any what the state is doing per se, but
yeah, I think that the Commonwealth, that the OMSAS is really aware of these challenges in our workforce and is doing what they can, to try to think through how to solve these dilemmas.
Yeah, I do know that they do understand, just from a lot of the things that I see come by, and kind of having a bit of a connection to the Children's Bureau, that they do know that there's the issue with the workforce, and they've been trying to look at ways to address it. It's just not an easy fix. Yeah. Right.
It's not an easy fix, and it's not just behavioral health. I think that's the challenge, that it's across services, across career types, across career levels. So that makes it complicated.
Yeah.
Do you think that folks are aware, and like you're saying, Jamal, are trying to address this in a multi-factor way because of the complexity of the topic? I forgot to mention, Jamal, there was one comment I also saw that somebody mentioned that they did have availability for PCIT. So I wanted to call that out, and now I have lost it in the comments.
Yeah, they come in, the chat just goes so much, so you lose things really quickly.
That's good, though. I appreciate that people are using it.
Yeah. I see Tiffany just posted, how can we encourage a family when they are not interested in early intervention and their child would benefit from it?
That is tough. Excuse me. I think it is being as supportive and helpful and positive as possible. Really just citing the ways that early intervention can be helpful and to get kids off to their very best start. Oh, look, Nancy, you are on it.
That's my Nancy.
Yeah. There are some of these, when you think about some of the pieces of some of early intervention or even PCIT, like we talked about, I feel like raising children is tough.
It is
so hard that any resource or any additional support that somebody can get is important to try. So I think that's another, as you think about rationales for why somebody might want to seek services or how you can kind of encourage people, is that children don't come with the manual, even though sometimes you really wish they did.
Right.
And so it helps to have support and advice from others. Even the most expert of parents can always use a little bit more support.
Yeah. It's funny because it's funny that you say that, because you do wish that they came with a manual, right? I have a 7, soon to be 8-year-old. He'll turn 8 in August, and I pretty much know what not to do. You know what I mean? Yeah. Like, from my experiences and how I was raised and things of that nature, when you know better, you do better, that kind of thing. I've had a ton of schooling, so I know a lot of what not to do.
Yeah.
But what to do they haven't really made a manual for that yet. So
and don't you feel like it changes? It just children are going through these developmental milestones, and when they're preschoolers, they're going through a lot of them quickly. and it's important for them to hit certain milestones at certain times, that even is a reason to have some consultation or some support, because they're complicated, they're going through a lot, and just understanding all of that and how you can help steer them in the best direction, or in the most helpful direction, is good, good advice to get from somebody.
Sure.
Even though caregivers know their child the best, they, I just feel like it always helps to have a little bit of feedback. And I would say, I mentioned I have a 10-year-old and a 15-year-old, and just how much they change over time, and to check in about what their behavior looks like compared to their peers is important to understand.
Yeah, for sure. I think sometimes we think they all grow on the same trajectory, and that's really just not the case. I don't think with anyone. We're all at different places, and it's okay.
Exactly.
Got to meet them where they are. So
the other thing that you're saying, Dr. Herschell, makes me think of the saying, "It takes a village," and I think that is so true, and that it's not shameful to ask for help. And there's been so much stigma, certainly around mental health, but in the raising of children, if you're not doing it right, you're not a good parent, all of those things that we have stigmatized people about, that we need to step back and say, whoa, and offer our help, and not be afraid to ask.
Completely agree.
Jamal, I'm not seeing any more questions.
I'm not seeing any more questions either.
Okay, then I wonder, maybe do we have a little bit, this video is like 4 or 5 minutes. Do you think, Nancy?
Oh yeah, we could do that.
Okay, because here's the thing that I really like about this video. It also talks about PCIT, but it's a family who is in Philadelphia area. So some of the other videos you saw, well, the first video was from Harvard. The second video was a national video from Miami. This family is from Philadelphia. It's a dad. I always like to make sure that we recognize dads as important caregivers. And this dad has a lot of wisdom. So he has a lot of important things to say. So do you mind showing that video, Jamal?
Not a problem. Let me pull it up.
And I'll just say in the comments, somebody also made the point about that it's better to get intervention early. 100% agree that the developmental project, they're off when behavior is outside of that normal limits, it doesn't go away on its own. So that's also something to mention. And that behavior problems in preschoolers, when you think about how that evolves over time, over the age range, it looks worse later. And I would also add that it's not like one day when kids are teenagers, you magically wake up and have a great relationship with them. That is late in the game, I would say. It's that you want to make sure that caregivers have really great relationships with their children early on, so that that evolves over time, and that the child always has a safe base to go to, and that safe base being their caregiver. Okay, I'll be quiet, Jamal. I'm sorry.
No worries.
So what parent-child interaction therapy really helps with is children who aren't behaving at school, kids who are on the verge of getting expelled from daycare or from preschool or from their kindergarten programs. It's specifically for children ages 2 to 6 who've been diagnosed or have symptoms of hyperactivity, attention deficit disorder, things like that, or kids who are displaying really aggressive or oppositional behaviors. So the parent and the child are in this room, or the caregiver and the child are in this room, and behind this one-way mirror, I am on a headset talking with the parent over the speaker, coaching them on what to say. For children who have developmental delays or autism, we're able to adapt parent-child interaction therapy to help them as well.
You have such a good memory too. It's very important. So to speak. But when I'm talking to him, he talks back because of the setting that we're in, that was created when we're actually in therapy. Because this is therapy. Therapy can be wherever you're at that time. He's in charge. He's in control. I'm following his lead, allowing him to be objective and creative, and I'm listening to him. I'm feeling what he's saying. I'm communicating with him, and when I give him appropriate praise instead of telling him what to do, I'm working with. Thank you for taking your time and helping me out too.
You're welcome.
When those times come in my life and in his life, when we need each other, we'll know how to approach each other, and not just that, but he'll know how to play with other children, how to be more of a friend to his friends at school, not being a bully, because we're not going to do bully things while we're having special playtime, and all that surrounds each other, and it's like it comes full circle, you know, because love and affection, I don't care who you are, how much money you have, everybody needs love and affection. When he wouldn't talk, man, and I was really, really concerned about that. I was really, truly, honestly concerned. Well, be careful, be careful.
What?
Get my little red when he see me sweating.
What are you doing?
Nothing. Daddy.
You're helping your daddy? Does he always do that, or is that a new thing?
No, he does it because he sweats too. And we both, you know, yes sir. Give me a big old hug. Thank you. Thank you for helping me out and wiping my forehead off. Thank you very much. Good job.
I'm Sal's teacher. Sal used to have a lot of tantrums, and he had a hard time listening throughout the day. What we're seeing is that he is beginning to respond better when we do give him directions, and he's becoming less aggressive throughout the day. He's having an easier time keeping his hands to himself and using his words to express himself, which is an important part of our day.
Once you learn these techniques, and you can do them all the time, every day, all day, until you really feel that that child is really, really understanding what special playtime means and bonding with that child. Parenting doesn't come with a guidebook. If I had $1 million, it could not compare to having that relationship with your son, your child, you know, that no amount of money in the world couldn't buy that, you know. It's the hopping, he said hopping, it's hopping ball. The hopping ball. And then that could be a negative too, because you don't want to use words like don't, no, can't. You want to use positive words as in, yes, you can do that. Oh, you're very good at pulling the bag out of the box.
First off, it helps Dad become more comfortable with the things that we are already saying to him, as far as different language and approaches and strategies that we use in school that he can also carry over in the home. It helps bridge that gap.
Come on, cut it out, Saul. You gotta stop. Sit down we're talking over here, so you gotta let us talk. When you hear people talking, you gotta wait until they finish talking, right? Good job, thank you for listening. It's a commitment, you know, but it's one that's gonna help your child. so that when I'm dead and gone, I want Saul to be able to function as though I was still here. I want him to be able to carry himself like a decent person, a good man, and not be afraid of things, people, places, or things. It's simple.
Try this strange 10-second technique tonight to reverse type 2 diabetes.
All right. So I hope you liked that video as well. I feel like Saul has, as a parent, has a lot of really important lessons for all of us to reflect on and learn about. And I know, Nancy, that you wanted to make sure we had a little bit of time at the end to talk about a few other important logistics. And I'm glad people are writing in that they thought that the video was very powerful and they enjoyed it. I'm so glad.
Yes, thank you, Amy. Let me repeat what I put this in the chat. Dr. Herschell has generously will be providing us with the slides, and I will be sure that you all receive them by email next week. I'm also going to put together resources from the chat and provide them to everyone because we're finding that that's a really big help for people that we're sharing some of these resources through attendees, and I think that that's an important thing for us to do. And then this is obviously being recorded, and when the recording is transferred for us, I will also make sure that everybody has a link to that. All of this will be on our website, and that will be in the email that I send out next week. Jamal, did I forget anything as far as that kind of housekeeping? Are we good with that?
No, I think you hit it all on the head, Nancy.
Okay. I want to say, it's so easy to say, oh, thank you, Dr. Herschell. Oh, what a great job, yada, yada, yada. And what an honor, yada, yada. The thing is, you were great. And the reason why is because I was feeling completely comfortable. Sometimes I'm not keeping up. Sometimes, I find myself maybe getting a little bored or trying to get too much information in all at one time and you get confused. This was perfect. And I felt your kindness, your generosity, your clear love of children. And I heard that man say that as a father, he wanted to know his child would be a good man one day. And my sense is that your work you're doing is because you feel that too, is that your hope is to see as many children helped by this as possible and send them out in the world to be models for their children. And that's all we need, that so much right now. And I'm also going to say, I hope that we see you again next year. Maybe we can work that out.
Humbled to have been asked and very grateful to participate today. I very much appreciate the invitation and thank you so much for having me. And thank you to all of the folks. I wrote this in the chat, but I also want to say it, which is I really appreciate people putting the comments in the chat, asking your good questions, because our intention really is to try to make content as interesting and informative and helpful as possible. Because like you said, Nancy, that's the goal, really, to try to have a positive impact on our communities and our youngest kids.
Yes, thank you so much.
Thank you.
All right, I'm going to thank everybody for being here today, and I'm going to invite you all to join us for our next presentation, which is Asian American Womanhood and Resilience. And it's a discussion of the Disney and Pixar's original film, Turning Red. Our speakers are Dr. Castillo and Noel Ramirez. They've been with us before, and they've really helped us in understanding the culture of the Asian and all the different types of cultures within the Asian community. That will be on Thursday, July 14th from 2:30 to 4. And I'll put that link into the chat now for everyone to have if you want to jump over and see that. And Jamal?
I had one question came in the Q&A, and I wanted to ask you on your way out the door, if you will. Kristen wanted to know your thoughts on using timeout in the classroom since PCIT uses timeouts. All of her teacher training has suggested not using timeouts, and she wanted to know your thoughts.
I have a lot of thoughts, and it's complicated. But I'll say that sometimes people use, I'll be brief. Timeout is really short for the true definition, which is timeout from positive reinforcement. So you might not see a really structured timeout like you would in some interventions, but there are things like calming corners and sit and think chairs and things like that that are actually meet probably the definition of timeout that are being used. And timeout is always the last, kind of a last resort, regardless of what you call it or what it sounds like. But it's a last resort and is used in the context of a lot of other behavior management strategies that are more prevention oriented. That's it in a minute or less. So I could talk about timeout for a long time.
Thank you. Do you offer this training in Spanish?
I don't, but there are others who offer, because I wish I were bilingual. Talented. I'm not, but there are others who offer training in Spanish, and all of the, like for example with PCIT, all of the materials are available in Spanish at that website pcit.org. The treatment materials are available in Spanish.
Thank you.
March, I am so excited about that question because I've been talking to Jamal about potentially going bilingual next year and having one or two of our webinars in Spanish. So thank you for bringing that up.
Yes.
So thank you everyone for coming. Thank you again, Dr. Herschell. It was a pleasure. Nancy, do you have anything else before we close out?
Just want to say thank you once again. Thank you to everyone who attended. Thank you for all the great questions and interaction. And thank you most of all to Dr. Herschell for putting all of the time and energy into making this happen for us. Thank you.
Thank you. All right.
Bye.
Bye.